Okay, perfect. And with that, I can go ahead and get us started. A few folks will likely trickle in as we're going. But good afternoon, everyone. Thank you so much for being here today. Welcome to the monthly research series hosted by the Carolina Community Coalition. The coalition brings together campus and community partners to address high-risk student behavior. Over the past few months, we've broadened our focus beyond alcohol and other drugs, and pedestrian safety concerns have been coming up more and more. We're interested in doing potentially some walkability assessments, and we're currently in the process of trying to determine what efforts are currently happening in the community, what partners around campus might be interested in getting involved, and what would be an effective way for us to collaborate. Andy and Farnaz are joining us today to talk about the Columbia Sidewalks Project, which is an ongoing collaborative study to evaluate the availability and quality of sidewalks in Columbia. So I'll do some introductions for them real quick before I turn it over. Dr. Andrew Kaczynski is a faculty member in the Department of Health Promotion, Education, and Behavior, a co-investigator with the CDC-funded Prevention Research Center, and director of the Built Environment and Community Health, or BEACH Laboratory, within the Arnold School of Public Health at USC. His research interests focus on environmental and policy influences on physical activity, obesity, and chronic disease prevention, and he has a strong passion for environmental justice. Dr. Kaczynski has published over 150 peer-reviewed journal articles and presented over 150 times to both academic and professional audiences on issues related to the built environment, parks, and public health. His research has been supported by the National Institutes of Health, the Robert Wood Johnson Foundation, and other diverse organizations and foundations at the federal, state, and local level. Andy is past chair of the American Public Health Association Physical Activity Section and the Active Living Research Conference. In his free time, he loves hanging out with his wife and three daughters, playing tennis, traveling near and far, and enjoying all of South Carolina's excellent craft breweries. Farnaz is a third-year doctoral student in the Department of Health Promotion, Education, and Behavior at the Arnold School of Public Health here at USC. She earned her bachelor's and master's degrees in architectural engineering, and her growing interest in environmental psychology inspired her to pursue further education in public health. Farnaz is passionate about exploring how various features of the built environment impact mental health, physical activity, and overall well-being. She currently serves as a graduate research assistant for several projects in the Beach Lab. And with that, I'll turn it over to y'all to get us started. Thank you.
Great. Thank you. Thank you, Jenna. Appreciate the invite to share some of our research with all of you today. And I know Carolina Community Coalition and Healthy Carolina does excellent work across campus. So I've always wanted to get a little bit more involved and communicate with y'all a little bit more. So thank you for this opportunity. I'll introduce myself a little tiny bit more, and then Farnaz can introduce herself a little bit more as well. But we got a few slides we will share with you. We'll try to keep this fairly brief today and have lots of time for discussion because we know it's Thursday afternoon. Everybody's a little bit tired, and this is probably your last appointment of the meeting of the day. But hopefully you can see some slides there.
Yep.
And yep, we've just titled this the Columbia Sidewalks Project because we'll share a little bit more with you in a moment about what we are doing to evaluate all the sidewalks across Columbia and try to examine issues related to pedestrian safety and equity and so forth. Here's a very quick outline of some of the things we'll go over today. We'll give some quick background about the built environment and why we should be concerned with issues like walkability. But then we'll dive into the CSP a little bit more detail. We'll tell you about our extensive study team, including lots of undergraduate students who are involved. We'll tell you about some project partners, including our community advisory board, and then we'll tell you about the objectives and the methodology for the study. And then I will turn it over to Farnaz about halfway through for the more exciting part, where she'll give you a demo of how we're going about collecting the data using an online, innovative online tool, and as well as some of our very preliminary findings from the study. And then hopefully towards the end, we can have some discussion about this study and these issues in general for Columbia and for campus. All right. So we'll just start off with this idea of social determinants of health. I'm sure it's very familiar to many of you already, but social determinants are the idea that there are conditions in the environments where people are born and where they live, learn, work, play, worship, and grow older that affect a wide range of health, functioning, and quality of life outcomes, as well as health risks. So there's a variety of different things. We're going to primarily focus on the neighborhood and built environment part, but we certainly want to acknowledge that there's a wide range of things that could influence people's physical activity levels, their obesity levels, their diabetes and chronic disease levels, and so forth, as well as various other issues around pedestrian safety, quality of life, social isolation, mental health, and so forth. But we come at things in the Beach Lab from this broader perspective about how does the environment and the conditions that we find ourselves in influence our health and health behaviors. And in particular, we're very concerned with neighborhood and built environments. So that kind of falls under this environmental conditions. When we think about the environmental conditions, there's lots of things, some of them listed here within our neighborhoods that could influence people's mental and physical health. Obviously, green spaces are important. Things like pollution, whether that be from toxins or noise, is very influential as well. The art and aesthetics of the environment can have a real strong influence on whether people want to interact with their environment and their mental health and psychological restoration and so forth. I would say that our project, though, primarily falls in these other two realms around urban design and walkability, which are both very important. When it comes to walkability, obviously there's a lot of different benefits. A lot of our communities have been designed so that they are not so walkable, including some of the neighborhoods proximal to campus, because a lot of neighborhoods in the U.S. were built in the 20s, 30s, 40s or so as cars became more prevalent, and we designed our cities and the neighborhoods and the streets therein to move people quickly and efficiently around in motorized transport. Unfortunately, that's left behind some of the benefits that earlier developed neighborhoods would confer to people around things like safety, so much easier to get around on foot and bike in more traditional neighborhoods because they're more likely to possess sidewalks and crosswalks, more narrow streets, traffic lights and other things like that that would kind of slow down traffic. So there's some safety benefits from walkability. There are also, of course, health benefits. It allows us to get around in an active way, and so that promotes physical activity participation, lowers obesity levels and other related chronic diseases. And then there's numerous other benefits as well, which we won't go into in so much detail today, but certainly environmental benefits, right? If we get more people out of cars, then that's less, pollution that comes in the form of whether it's, in a neighborhood or lots of cars idling around schools, whether that's USC or elementary schools. That can really, if we get more people walking and biking to different destinations, then it's going to cut down on the amount of traffic and the amount of time people spend sitting in cars. Lots of economic benefits that come from walkability as well. So if we have people kind of moving more slowly and enjoying things and they're more comfortable in spaces like on Main Street or in Five Points or in the Vista and so forth, then that's going to bring about a lot more economic activity in those kinds of spaces too. So there's lots of different benefits. We could get into all of that. But the primary thing that we wanted to focus on today was more around pedestrian infrastructure and safety kinds of issues, because sidewalks in particular are really foundational for promoting walkability, for helping people to feel safe, and for promoting objective safety. Also for bringing neighborhoods together around social cohesion, right? So if I've got more sidewalks in my neighborhood, I'm more likely to be out there walking and using them and waving to my neighbors and passing by people and going to the corner store or to the library down the road and so forth. And it just kind of promotes a more inclusive and cohesive kind of neighborhood. Unfortunately, there are studies that show that disparities exist in sidewalk access, and especially across the southeastern US, where we have lesser access to active transportation amenities like sidewalks and bike lanes. And overall, every census tract or a block group actually in the United States receives a walkability score based on the National Walkability Index ranges from 0 to 20, and the average score for Columbia is 6.89, which is classified as poor overall or below average walkability. So obviously there's some work to do there. And so we talked about a lot of different benefits of walkability, but the primary one we want to focus on today is around pedestrian safety. And there's a lot of statistics that show that these kinds of issues are only getting worse over the last 20 or 30 years or so. So even just over the last couple of years, the fatalities that are attributed to cyclists and motorcyclists increased 8 and 5% respectively. And then amongst pedestrians have gone up as well. And this is especially prevalent in certain areas, as we'll talk about later, including in rural areas, but also lower income and higher minority areas as well. And South Carolina is particularly problematic for these issues, with pedestrian death rates being 60% higher than the national average in our states. Um, some research has examined whether, the availability of sidewalks helps to promote pedestrian safety and reduce fatalities and crashes. And the answer, not surprisingly, is that yes, when roadway segments contain sidewalks, then the number of pedestrian crashes is significantly less. And we can tell you a little bit more about that type of research and these studies, but these are the kinds of things that we're going to try to examine in Columbia here specifically so that we have local evidence that we can share with policymakers and understand what's the situation throughout Columbia neighborhoods. So the Columbia Sidewalks Project, the overall goal is to be an innovative, equity-focused initiative that evaluates sidewalk accessibility and quality across Columbia, South Carolina. And we'll tell you about the study settings specifically in a minute. And in order to link sidewalks to health outcomes, in order to guide planning and to community planning and to promote health equity. So one of our students came up with this lovely logo for the Columbia Sidewalks Project, and we'll tell you a little bit more about the methodology in just a moment. Our study team is comprised of a whole bunch of important people. I am probably the least important here, but I am our principal investigator. I'm an associate professor in the Department of Health Promotion, Education, and Behavior in the Arnold School of Public Health. I've been at USC for almost 15 years now. And as Jenna said earlier, my research primarily focuses on the built environment. How can we design healthy communities, and including with an environmental justice emphasis? So I'm really concerned about equity type issues. Farnaz, though, is the real brains behind the project. She's a third-year PhD student, and she can tell you a little bit more about herself, but she's done a wonderful job managing this whole project. And then we have a wonderful team of one master's student and 8 undergraduate students who have been working very hard over the past 6 to 12 months or so, collecting all of the data about Columbia's streets and sidewalks. And 2 of them are actually doing their honors thesis using all of this data over the next 8 months or so. So here's some of them. We didn't manage to get everybody together for our picture a couple weeks ago, but they are really the driving force behind collecting all of the data. And I think they're really enjoying learning about these issues and contributing to a very applied community-based project. We also have numerous project partners that are very critical. I'll start on the bottom of the slide here. As far as our academic team, we have people from a variety of different disciplines across USC. So Dr. Chen is from civil engineering, has a strong focus on transportation. Likewise, Dr. Wong from geography also studies transportation-related issues. Dr. McLean is our statistician or epidemiologist. And Dr. Levy from sociology looks at kind of neighborhoods and health outcomes from a sociological perspective. We're also very blessed to have some wonderful community partners, including 2 people from the city of Columbia, Lucinda Statler and Lee DeForth, who both work in the city of Columbia Planning Department. They've been incredibly helpful with respect to providing data and helping us to guide some of the questions within the study, and just overall their enthusiasm for what we're doing here, and some of their interest in using some of the findings has been very helpful. We also have a gentleman from the University of Washington, School of Computer Science and Engineering. His role will be more clear in just a minute, but they were the developers of the Project Sidewalk tool that we have been using to collect data all across Columbia. And then we also have a community advisory board, which is comprised of people that are local or state officials from across Columbia or South Carolina, who have a very strong interest and expertise in some aspect of this project. So Robin Cooper is with the Alliance for Healthier Generation, which helps to promote healthier schools. Guillermo Espinoza is from the South Carolina Department of Transportation as their bicycle and pedestrian planner. Matt Collins is from the South Carolina Department of Public Health and really deals with a lot of data and community engagement. Dara Brown is also with the Department of Public Health at the state level as their active communities coordinator. Mia Shells is for Richland County specifically. Used to be called Eat Smart, Move More Richland County, but now called Live Well, or sorry, Live Healthy Richland County. Kaysen Stark is with ABLE South Carolina and is their transportation program coordinator. ABLE, if you're not familiar, deals primarily with disability related issues across the state. And Reagan Freeman is the executive director of Palmetto Walk Bike. So we're very fortunate to have this really knowledgeable and talented group of people who are kind of providing guidance throughout the study. Our funding support, we're grateful to two internal grants that we received, one from the Office of the Vice President for Research through the Aspire mechanism, and another internal mechanism on campus here that's called the Collaborative for Health Equity Research, or CHEER. So thank you very much to them. And before I turn it over to Farnaz, I'll just share a little bit about our study objectives. So the first one is simply to assess the availability and quality of all sidewalks on all streets in Columbia. So Farnaz can tell you a little bit more about our study setting in a second, but that's kind of an undertaking in and of itself, is simply to understand, what streets have sidewalks and which ones don't, and all of the different attributes of those sidewalks as well, kind of what's the quality of them. Once we have all of that information, we want to look at disparities in sidewalk availability and quality by income and race and ethnicity and maybe education levels and other things like that in different neighborhoods or census block groups across the city. And then lastly, we want to look at, well, if you have sidewalks or if you don't have sidewalks, or if there are varying levels of quality, what's the relationship between that and different health outcomes like physical activity rates or diabetes rates or more mental health issues and so forth. So in order to accomplish that, we are using two conceptual frameworks, one that hopefully you're very familiar with, maybe both of these. First is the social ecological model. As you probably know, the social ecological model kind of states that all health behaviors are kind of influenced by different levels that are more or less proximal to the individual. So you could have the intrapersonal level. We obviously deal more at the more community and public policy level. That's not to say that, people have to make positive choices about their physical activity and their healthy eating and so forth, but obviously those choices are shaped by the resources that they have available to them, including things like sidewalks and parks and stuff that would influence your physical activity participation. And then we also want to think about all this from an environmental justice framework. So environmental justice kind of has two primary components. The first being the obvious one, that we want everybody to have equitable access to positive resources within the community, like sidewalks and grocery stores and parks and things like that. And the second component being that we want people to have kind of the information and knowledge and resources to be able to participate in the processes that bring about that justice. So it's not just about me as a researcher or somebody who works for the city, doing a study and doing all of the planning, but we want people who are affected by these issues and who live in the communities that have or don't have the sidewalks to be able to participate and have the information and the knowledge to bring about positive changes. So that's kind of the second, more participatory component of environmental justice. Our study setting is Columbia. Here's a map of all of the census tracts in Columbia. We are not venturing out, at the moment at least, into West Columbia or Lexington or Irmo's way up there, up that direction. That's a possibility, certainly for future, but it was a big enough undertaking to just tackle Soda City here for the moment. There are 74 census tracts and 141 census block groups within Columbia proper. So our three aims, just to give you a very quick overview of the methodology. For aim one, we're going to look at the availability and quality of all sidewalks. What we're going to do is use this tool called Project Sidewalk. Farnaz will give you a lovely introduction to it in just a moment, but basically we use Google Street View, if any of you are familiar with that, and if you're not, you'll see it in just a moment, to virtually walk all of the streets in Columbia in order to evaluate, is there a sidewalk present, or all of the other different attributes that are listed here. Things like, are there curb cuts on the sidewalk or curb ramps so that people with wheelchairs or other mobility issues could easily access the sidewalk? Or is there a missing curb ramp where there should be one there? Are there obstacles in the path? Are there other surface problems like it's all broken up or something? Is there no sidewalk in general? We also look at crosswalks. So can you go from one sidewalk to another safely and easily? Is there a pedestrian push button that would allow you to stop traffic and get across the street? So from all of that information, we're going to develop a sidewalk accessibility and quality index where we can kind of create a scoring system for a street or the agglomeration of streets within a neighborhood or a census tract and so forth. So that's the first step, anyways, collect all of that data. The second step then is to pair all of that information about sidewalk availability and quality with data from the American Community Survey, which provides information for neighborhoods or block groups about things like poverty and income levels, unemployment, education, age, race, and ethnicity, so that we can perhaps see, are there inequity issues with respect to sidewalk availability and quality across the city that we need to be cognizant of and try to address. And then the last aim is to pair the sidewalk data with CDC data that are available that at the census tract level that examine a variety of different health issues. And some of them that we're particularly interested in are obesity levels and physical inactivity levels, the percentage of people who have a mobility disability, and other mental health concerns like depression. So hopefully, through these three aims, we can provide a wealth of information that will not only document the condition of sidewalks, but some of the equity and health outcome issues that might be sort of attributable to the availability or lack thereof of sidewalks. So I will turn things over to Farnaz now to tell you a little bit about how our team is going about collecting all of this valuable information.
Thank you, Dr. Kaczynski. Hi, everyone. Thank you so much for joining us today. I'm Farnaz, third year PhD student, and I just started doing my dissertation, which is relevant to sidewalks availability and quality across US. And I'm so excited about Columbia Project, Sidewalks Project specifically. So may I share my screen, please?
You should be able to, I think. So I should have stopped mine. But,
I think here we go.
Yep, there you go.
Yeah. Well, yeah, this is how Project Sidewalk website looks like. We'll have a short demo later on in a minute, but I just wanted to show how it looks like when you go to their website. And when you click on Explore, it will direct you to Google Street Views that you can see all streets and sidewalks, and then you can start examining all of them. So I'll just give a quick review of how it works, and then we'll have a quick demo as well. Okay, yeah, when we start examining the sidewalks using Project Sidewalk tool, we have this interface that you can see here. Can I minimize it? Okay. And then on top, at the bottom, at the top of the page, yeah, we can see different types of labels, including curb ramp, missing curb ramps, obstacle in path, surface problem, no sidewalk, crosswalk, and pedestrian signal. We can use these 7 features to examine the availability and quality of sidewalks. And on the right side, at the top of the page, we can see the overall stats of this specific neighborhood. Like, for example, the total number of miles that I have examined, the number of labels that I have generated in this specific neighborhood, what's my accuracy level, and then down below we can see the information about this specific neighborhood. Like, for example, this is section number 67. And then down below we can see different features. Like, for example, in this neighborhood, I have generated 1 curb ramp, for example, or 2 missing curb ramps. And then down below we can see the mission map, where we can see where we are headed to. Like, that red line shows that I'm supposed to examine the condition of sidewalks in this direction. So this is Google Street View that we mainly work on and look through all streets and sidewalks, as I mentioned. And we are good to go and jump into the demo itself. So can you see my screen now that I'm in?
Looks good.
Okay, thank you. Yeah, when we go to a project sidewalk tool, then we see this interface that I explained earlier. We have different tabs, like my dashboard, the city, different cities that this project is deployed, like different tools like gallery, leadership, label, map, road builder, that I'll explain later. But the main tab that we use to examine different features of sidewalks here is Explore. So when we click on Explore, for the first time that users are using this tool, they need to take the tutorial. But after that, that's gonna be optional. And then we can just click on Start Mission, and it directs us to the neighborhoods that needs to be examined. I already did that, so it directed me to this neighborhood, which is section 5. And then we can turn around and see the different sidewalks here, and then use these 7 features that I already mentioned to examine. Like, for example, I see lots of obstacles in paths here, so I'll click on obstacle in paths, then click it on them, and then it requires me to rate the severity from low, medium to high, and then I need to choose the associated tags. Like, for example, if it's construction, it's tree, it's pole, whatever it is. And then I'm welcome to write a quick description about it. But what's most important is the rate severity and the tags. Like, because, for example, when we create any of these features, it instantly generates a unique GeoID code, which is the location, the information of the location of this specific label, and it will be provided through the Excel spreadsheet. And then once I'm pretty sure that all features are being labeled here, I'm good to proceed. Like, for example, on this side of the street, I don't see any sidewalk, so I'll click on, for example, no sidewalk label and place it here, and then I can choose another tag, whatever that is needed here, and then I'm good to proceed. As you notice on the mission map, when I clicked and proceed, instantly a red line was shown on the map, which means that I'm on the wrong direction. I'm not supposed to examine these sidewalks, so I need to turn around and then click and make sure that I'm on the right direction. And as I go forward, as you can see, the red line turns to green line, which means that I'm on the correct path, and also these amount of spaces or lines are being evaluated so far. So this tool is pretty smart because it can catch if I'm accurate or not. For example, if I miss lots of features on this neighborhood and I just arbitrarily proceed without putting the necessary labels here, by time the tool recognizes me as a bad user and my labels and my examination won't be counted anymore, and all the labels that I have generated so far will be removed from our data set. So this is pretty cool. And do you have any questions so far using this tool?
I do have a question. Do you ever run
Sure.
into the issue of the street map being like pretty outdated for some
Yes.
parts of the city, and like how do y'all navigate that?
Yeah, that's a great question. That was one of the first concerns that we had. Yes, unfortunately, some of Google Street Views or images are so outdated, and for those, we try to find another frame that is closer to the newer one. Like, for example, if some of them are for back 2007 or 2014, we make sure to click a bunch of like move forward or backward to see another frame that is being taken uh, like later on, like 2023, 2022. And another thing that I need to mention here is a limited number of images are pretty outdated. Most of them are so new, and for those that are outdated, we wanted to make sure to go there later on and explore them manually.
Yeah, some of them we will visit manually, but the Project Sidewalk folks were able to generate sort of a graph of when were all of the Google Street View images that they have downloaded into the Columbia auditing platform, what were the dates for them, and it's pretty good, like over 85% or so are within the last few years. And sidewalks obviously do change to some extent, but they're also somewhat fairly stable, right? But certainly in Colombia, we are seeing some good things happen in select areas. So we want to visit those in person. That's a great question. Yeah.
Perfect questions. So, well, yeah, so now next thing that I need to mention is validate tool. So now that we have generated a bunch of labels here, we need to know if they are validated or not, if they are correct or not. To do so, we need to use validate tool by clicking on it and start measuring different labels that are being created by our different members in our lab are being shown on the screen, and it asks me whether if it's correct or not. Like, it asks me, is this a missing program or not? I can say if it's correct, I'll say yes and click and move forward. If it's not correct, I'll say no, and I'll provide a short note why it's not correct, and it will be directed to the user that has been generated this label, and then they'll know on their dashboard when they check their incorrect labels, they'll know why they have created a mistake. So, and then, for example, this one is a missing program to some extent, so I'll click on yes, and then we can see other labels ahead. So this is one way that we can ensure the validity and accuracy of our work. And we have the overall set of this, like when we go to leaderboard, we can see the overall accuracy of each users here, as well as the overall accuracy. Like the overall accuracy of our work so far is 91, around 92%. And another thing is label map. Like, label map shows all the labels that have been created so far in Colombia. As you can see, there are mostly are no sidewalk label. And yeah, any questions? Okay, awesome. And also the last thing to mention is like my dashboard. For example, any users need to check their dashboards regularly to see only the labels that they have created. And also check out their overall accuracy, the number of validations, labels, distances, and missions that they have created so far or accomplished, and the mistakes that they have created, like curb ramp, missing curb ramps, obstacles in path, surface problem, and so on. So would you please let me know if you can see my slides now?
Yep, we're back to there.
Okay, sure. Okay, thank you. Well, yeah, as I mentioned, these are the different labels that we mainly use to examine the condition of sidewalks. But before starting collecting our data, we did a great job to design a comprehensive package to train our students, like a comprehensive project sidewalk tool explanations and tool tutorials in several sessions. And then we did a lot of practice and played around with tool. And then we had several sessions for question and answers, and also with both our team members and the developer of these projects. And then we designed a reliability testing. We didn't stop we were not satisfied with the validating tool itself. We were like, we need to do more, and we designed our reliability testing. And then we checked it with everyone to ensure that the labels that are being created are pretty reliable. And then after that, after ensuring that all members are good and confident to work with this tool, we started collecting our data. But I myself track the accuracy of each member on a regular basis. And then we use the validating tool in an ongoing way. And then we continued collecting data, but now we are pretty much done with collecting all data. But we had a bi-weekly training, reviewing session, and question and answer sessions. And also, these are some examples of the reliability and validity check that we designed with the great instruction, and we checked the reliability in several sessions with our teams throughout the project. And also, we designed another package to ensure all streets in Colombia are covered and all census tracts are being completed 100%. And by that, here you go. You can see all the sidewalks in Colombia that are being labeled, and unfortunately, mostly no sidewalk available. And here you can see an overall statistics about that. Like, for example, the total validations, the total labels that have been created so far, like by our 8 members, we have created 97,000 labels so far. And the overall accuracy is around 92%, and 1,762 kilometers distance are being explored. And also, you can see the total users as 22, because some other people that developed this project are being involved, but they were just checking like the validity and accuracy of our work. And here you can see the label.
You guys are the first people to ever, I barely have seen, I only saw this information yesterday, so it's hot off the press. And don't share it entirely because we still need to clean it up a little bit, but we've got some very interesting findings so far. Go on, Farnaz.
Yeah, thank you. Yeah, because we just finished collecting all data about all sidewalks in Colombia. We recently obtained these great information, and as you can see, more than 70,000 of all those labels that we have created are just for no sidewalk label, and around 10,000 is for curb ramp, and after that, around 5,000 are for sidewalk surface problems, and also so forth, as you can see. And this, in terms of the severity, missing curb ramp has the highest severity, as you can see, above 2.5, followed by obstacle in path and surface problems. And in terms of the accuracy, as you can see, the no sidewalk label has the highest accuracy, meaning that all those labels, all those locations that are identified as no sidewalk present are pretty accurate. So I'm so glad that we ended up having such great information to inform policymakers later on for people in city of Columbia and other sectors that really think about like building sidewalks in Columbia and make it more walkable. And yeah, by that, I'll turn it over to Dr. Kaczynski. Thank
Sure,
you.
you can keep hitting the slides there, but yeah, I mean, I just want to emphasize again that our student team has worked so hard on all of this. We've really put them through the ringer in terms of training and data collection on a weekly basis and all of that. I think they've found it somewhat fun in that the interface is kind of like a video game and it's, using technology and kind of innovative and everything, but they've really been dedicated over the last 6 months or so. And we're finally at the point where I think we've got every street covered. And now we can do a little bit more. Like one of the things, for example, is we'll create a heat map of all of the neighborhoods or census block groups in Columbia to show different scores. And they could be different scores by sidewalk availability or by curb ramp of presence or not, or other things like that. And it'll kind of give like a heat map or of where the sidewalk deserts are and so forth across Columbia. So lots that we need to do still, obviously, and I apologize that we didn't have it done quite yet for this meeting, but hopefully we'll have some pretty cool results and maps to share with you all soon. So that's where we're at now. We're maybe a month or so behind schedule here, but not too bad. We're going to dive into the sociodemographic analysis next to try to look at equity issues. And then throughout the spring, we will compare sidewalk access with health outcomes. And then we're hoping to share this in a variety of different ways once we've kind of gotten everything put together towards the end of next spring or so. So next slide. Some of our expected outcomes are we hope to publish this in some peer-reviewed public health or transportation or equity type journals. I think what we're doing here has a lot of scientific rigor and can be a nice example of a community-based study to look at both equity and health issues. So we're hoping to share that with other researchers, but we're also very interested in doing reports and presentations and so forth that are community informed and driven by the needs of the community and in collaboration with the people on our community advisory board and the City of Columbia folks that are our partners in the project. So we'll have some lengthier reports with an executive summary. We'll have some one-pagers or two-pagers that are kind of like research briefs and infographics and things like that. So we certainly welcome your input as well as to how you think this information would be best be disseminated and useful to people. Farnaz and I also like to get out there and we love doing presentations like this. So we certainly visit some academic conferences and then we will also hit some professional conferences. So we're very active with things like the South Carolina Public Health Association conference and others. And, if you have suggestions for that, we welcome them as well. And then we're hopeful that this isn't the end of this project, that we can secure some additional funding to maybe expand this to other communities in the broader Columbia area or other communities and cities statewide as well, because certainly are some of our partners with the State Department of Transportation. They're like, we don't have the capacity. We've always wanted to do something like this, but we don't have the capacity. And we would love to see this done in some other cities across South Carolina. Farnaz is also looking at some of these issues in some other cities across the country as well. So just to summarize, this is the first detailed sidewalk that I'm aware of, audit of Columbia streets using this innovative project sidewalk tool. We've got a wonderful team of students and partners and collaborators, very interdisciplinary. And we hope that it's an equity-focused evaluation of how does the built environment influence people's health and well-being. So some of the questions that we wanted to throw out there, but we are very open to hearing more questions from all of you in the limited time that we have left here. But we were like, I'm curious what you all think about the current status of sidewalks in and around Columbia, and especially either on those streets that run through campus or the streets that border campus where students are coming from the blossoming number of housing complexes that are nearby. What can we also do beyond sidewalks to encourage greater and safer active transportation amongst the faculty, staff, and students who are trying to access and get around campus safely? What sorts of partners do we need to engage both on and off campus to try to improve campus walkability and pedestrian safety? And, how can our project, from what you know of it now, help address any of these issues or others that are important for pedestrian safety and walkability on and off campus and so forth? So happy to chat about any of that or anything else that you all are interested in learning more about. But just before we end here, I just want to say thank you very much for all your time and attention and for bearing with us through those lengthy slides. But we're thrilled to be able to share that study with you.
No, thank you so much. That was great. And I'm so glad you asked those questions. Those were the same questions that I was planning on posing to the group as well, and some things that we've been talking about. And I see Anna Catherine has her hand up. She is extremely passionate about this topic, so I'd love to hear what her thoughts are.
And tell us, if you don't mind, what your role is with on campus or other community organizations or whatever. That'd be helpful.
Anna Catherine, if you're speaking, we cannot hear you.
Oh dear.
Mm.
Want to go over to Molly next, who has her hand up too?
Yeah, we'll come back to you, Anna Catherine. You can go ahead, Molly.
Perfect. As soon as Anna Catherine gets her mic, I'm happy to pass it back. Well, thank you all so much for the great work you're doing and for sharing it with us. I'm Molly. I serve over in our Office of Civil Rights, and we do, among some other things, ADA accessibility. And so we often get reports from folks about sidewalks, and have been partnering with other people, some of whom are on here, to bring attention to these issues. And then we'll work with facilities to fix some of the sidewalks. So to answer some of the questions that you posed, curb cuts are a big one. And then like one of the pictures that you showed, folks who are temporarily blocking sidewalks. So like during a construction phase or something like that, and like there's not signage for redirection.
Yeah.
And
No,
the
these
other
issues are really
instructions.
important, obviously, because whether it's people who are perfectly abled mobility wise, or especially people who are a little bit more challenged, we don't want them to have to venture off into the streets for a segment of the street if there's no curb cut to get up onto the sidewalk, or if something is blocking it and so forth. So might be very happy to know that one of our undergrad thesis students, Riley Smith, who's in public health, is looking at accessibility issues specifically for her thesis. So she's going to take this data and focus in on things like curb cuts, obstacles in path, and other things like that were of interest to her from a disability perspective. So we're excited to dive into some of that in a little bit more depth.
Amazing. Well, cannot say thank you enough. Someone had mentioned that y'all were doing this work, and I'm happy to hear and see some of the great work y'all are doing.
Thank you.
Any better now?
Yes.
Yep, we can hear
Yes.
you.
I think this happens every time. I'm Anna Catherine. I'm the Interpersonal Violence Prevention Coordinator with Sape. I have a little bit of experience with having to request curb cuts be brought to my community. I encountered some barriers navigating the community, not the community I was particularly living in, but just encountering it as a person who uses mobility aids. went through the process of requesting them, the process, et cetera, et cetera. Luckily, their curb cuts are there now. Really exciting to see that having come to fruition. So it's a really neat process. Kason over at Able is a colleague of mine. I am super passionate about walkability. I giggled when Jenna said it. I find that sometimes walking around historic communities can be a beautiful scenic route because I get to take the scenic route when there's no exit across to the crosswalk.
Yeah.
So I'm really excited to see all the work that you guys have been doing and all the efforts that's happening. And I kind of agree with everything everyone said so far. In addition to, one of the neat things I'm noticing right here, so close to my building, is that there's now no right on reds. And it's really improved safety for a lot of the students because the cars are not turning directly into the traffic of the students, because the students are not dodging cars nearly as much as they were before. So I'm very happy to report something I've observed since I've been here 1 year. So I'm just so happy to report that I've noticed that change in just the year that I've been here, that the students are able to more safely navigate the sidewalks right here by me. But yeah, so I'm so happy that you guys are here. Something I've noticed. And my question was specifically about what have you guys noticed about the audible signals? We have some audible signals, like specifically like the pedestrian signals. We have some near campus, some in 5 Points, some kind of in the community. How often do you see those kind of being integrated into Columbia?
I don't know that I can speak to that in a perfectly accurate way, but just I do pay attention to those things like you do and many others, I'm sure. And yeah, I'd say that there's a lot of work to be done. In our study, unfortunately, we're not able to capture that, sadly. I think that we'd love to do a study that is, even more of an emphasis on disability related issues, whether it be mobility or auditory or other issues as well. But I think that'd be a focused effort on its own that could be a follow-up to this. But I mean, I think Columbia is kind of lacking in a lot of the signals and crosswalks and technology kinds of issues. But in a more positive light, like you said earlier at the start, there's a lot that is improving in Columbia, and I'm very encouraged. And I'm also encouraged by the interest and enthusiasm amongst city officials and staff and advocacy folks, whether it be people like Kason with Able South Carolina or some of the other folks on our advisory board. And so we are seeing a lot of positive things happening, whether it be the road diet in 5 Points and other things that have been done there to help keep the kids who are maybe had a couple extra drinks on Thursday night safe or whatever, or have all of us pedestrians right. All of the things that are happening on South Main Street there. There's supposed to be things happening in my neighborhood in West Columbia, just across the bridge on Meeting Street. So there's a lot of enthusiasm for these kinds of things. And I think that's a testament to the fact that people are paying more attention to these issues, whether it be because of a walkability or safety issue or an economic driving factor or whatever the motivation is. We're seeing a lot more advancements, and I think that's encouraging. And hopefully, studies like this and other advocacy efforts, like the things that you mentioned, even small things of individuals advocating, will only kind of increase the momentum for attention to these types of issues. Yeah.
I just wanted to mention something. When we use pedestrian signal, we can add tags like tactile audible buttons, hard to reach buttons, or 1 button or 2 buttons. So we didn't require our students to add tags. It was a kind of optional to them because we were mostly leaning toward like the severity of the item or if we have the missing item itself. But most of them use tags, and most of those pedestrian signal that we created across Columbia had kind of tags, whether they are just one button, two buttons, or they are tactile audible.
There you go. Cool. Thank you for the question, though. I appreciate it.
In terms of locations around Columbia, one thing we've been talking about is the path that students are taking to walk to the stadium. We do offer shuttles, but I've heard from a variety of people that due to the wait times, a lot of students have been making the choice to walk. And my understanding is that there's not like a fully sidewalked path that students are able to take to get there.
Yeah.
So that's something that we're really interested in looking more
I think
into and want to
that's
share that.
great. And I'll say a couple quick things, one personal and one that I learned more professionally recently. So I have daughters who are a freshman and senior in the Honors College in nursing. And my freshman, I drove halfway to a football game a couple weeks ago, and it was very eye-opening for me. And I was kind of like, well, you're on your own from here on. And everybody's, yes, you're right, just walking down Assembly and Shop Road in order to get there. And I think that's incredible and incredibly dangerous that we're subjecting our students to that. Yes, there are shuttles, but as you said, they, are very inconvenient from what I've heard. On a more positive note, I'm not sure this is public knowledge yet, and don't quote me on it or anything, but I've heard that there's a strong momentum and actual planning happening, obviously no concrete on the ground yet, to turn an abandoned railway line like the one that the cockabooses currently sit on into a rails to trails type path that would take students from about Blossom-ish all the way down to the stadium on a path that is completely separated from the road and would hopefully have like some benches and some trees and other things like that to make it nice and all that. So that could be, a good 5 years or more out, but I've heard that from some people who are in charge of planning type things for the city. But that's the best I can tell you for the for the moment.
Yeah, that would be incredible
It would
to
be.
see. That sounds
But and
amazing.
if that's something y'all would like to see, I would highly recommend that you advocate to, and I can tell you, possibly give you some names of people to talk to. I hope it's been on their radar for a long time, and I'm not sure why it's not been addressed yet, but apparently it's on their radar now, at least.
Yeah, that's really good to know. With our last couple of minutes, I did want to share a couple of links in the chat. So City of Columbia right now is doing a survey on all types of transit and pedestrian safety topics, and they've opened that up through Sunday. So people are still able to take that. There's like an interactive map that covers the entire city where you can put in like little comments and notes about things that you'd like to see. If you have any ideas for changes, you can put those in there. And then USC is also doing a mobility plan survey. So if you have any ideas for transportation on campus, you can go ahead and share that there as
Awesome.
well. So want to make sure that everyone has those opportunities to give feedback because I guess you're right, Andy. It is a really hot button topic right now. Everyone wants to know your thoughts. So now is the time to share it out. But thank you all so much for that presentation. It's like really honestly powerful to see the great work that y'all are doing in the community and to know that people care about this topic. And I'm just so excited to see what people are able to do with all of this great information that y'all are collecting. So it was really exciting to get to hear about that.
Well, thanks very much. We appreciated the opportunity to be with you all and share some of this today.
Yeah, thank you all so much. I hope everyone has a great day. I'll leave the Zoom open for a minute so that people can copy and paste those links as they need to, but y'all have a great rest of your day.
Take care. Good night.
Bye.
Thank you. Bye.
Thank you.